Hey there, future psych nurses. You know that feeling when you first walk onto a clinical floor? That kind of mix of, okay, I'm excited and, oh my gosh, what am I supposed to do? Yeah, final exams can feel just like that. But hey, don't worry, we're going to get through this. Think of this as your secret weapon, a high-yield review where we cut through all the fluff and get right to what you absolutely need to know. You're going to walk into that exam feeling totally prepared.
So my goal for us today is super simple. Let's trade in that feeling of being overwhelmed for a feeling of I've got this. Seriously, we're going to break down the topics that show up the most, unpack the key ideas, and give you some tools to make sure this information really sticks. So let's just dive right in.
Here's our game plan. We've pretty much worked backwards from your final, organizing this review based on how many questions you're likely to see for each topic. We'll kick things off with the heavy hitters, eating disorders and wellness. Then we'll hit neurocognitive stuff and some modern treatments. And we'll wrap it all up with the quickfire review to make sure you're feeling solid. Okay, first up, eating disorders. This is a big one. You're looking at about 15 questions from this topic alone, so we need to lock this down. We're going to make sure you are ready for every single one of them.
Think of this slide as your ultimate cheat sheet for telling these disorders apart. So for anorexia, the big tell is that significantly low body weight. That's your key. For bulimia, you're looking for that cycle, binging, followed by some kind of compensatory behavior, like purging. Now, for binge eating disorder, the most important thing to remember is the absence of those compensatory behaviors. Knowing these little differences is going to be a lifesaver on those tricky, select all that apply questions.
All right, let's talk about a huge safety issue, refeeding syndrome. This is serious stuff. When a patient who's been severely malnourished starts to eat again, their body's metabolism suddenly kicks into high gear. This causes a massive shift of electrolytes from the bloodstream into the cells, and that leads to a dangerous drop in phosphorus, potassium, and magnesium. This can absolutely be a life-threatening emergency.
So, what's your job as the nurse? What's your top priority? It's monitoring those labs every single day. You're going to be laser focused on phosphorus, potassium, and magnesium. And hey, this is where a good mnemonic can be your best friend. Just remember, patience packed with a meal. The keys in EMS will help you remember phosphorus, potassium, and magnesium. It's a simple little trick that can totally save you on a tough exam question.
Okay, let's keep the momentum going and move to our next big topic, stress, sleep, and wellness. This is another section with about 15 questions, so it's really all about understanding that powerful connection between what's going on in the mind and what's happening in the body. You know, understanding how sleep actually works is pretty important. We cycle through these different stages all night long. Most of our sleep is that lighter NREM sleep, but the one you really want to pay attention to is NREM stage 3. That's our deep, restorative sleep where the body does most of its repair work. Then you've got REM sleep, which is when we do most of our dreaming. It's really crucial for mental restoration. Now, for obstructive sleep apnea, or OSA, you've got to know the signs both night and day. A lot of times, it's the patient's partner who notices the nighttime stuff, the super loud snoring or the gasping for air. But the patient themselves, they're going to come to you complaining about the daytime symptoms, waking up with a headache, feeling tired all the time, or just being really irritable. Recognizing both sides of this is a huge part of your nursing assessment. Okay, here's a huge test tip. If you get a question that asks for the first or the best intervention for someone having trouble sleeping, the answer is almost always sleep hygiene. Before we even think about medications, we have to teach the basics. You know, things like keeping a regular sleep schedule, not napping for too long during the day, and avoiding caffeine or looking at screens right before bed. It's really foundational care. All right, let's tackle a classic topic that honestly trips up a lot of students: telling the difference between neurocognitive disorders. This section is worth about 10 questions, so we're going to nail down the key differences between delirium and dementia. And we're going to do it by learning the cardinal A's. This chart is everything for your exam. If you remember one thing, remember this. Delirium is acute and it fluctuates. It comes on fast. Think about a patient who's totally fine in the morning, but by the afternoon, they're confused and agitated. It's almost always caused by some other medical problem, like a UTI. Dementia, on the other hand, is slow. It's a gradual, progressive decline that happens over months or years. Fast versus slow, that's the key. So, to really understand dementia, you have to know these 5 cardinal signs. The good news? They all start with the letter A, which makes them a little easier to remember. Let's just run through them real quick so you can lock them in. First up is amnesia. This is the one we all think of, right? Memory loss.
But specifically, it usually starts with having a hard time learning and remembering new things. Second, we have aphasia. Think of this as a problem with language. The person might really struggle to find the right word, or their speech might just sound jumbled and hard to follow. Number 3 is apraxia. This one's a little tricky. It's an issue with motor planning. So the person isn't weak, and they want to do the task, like, say, using a fork, but their brain just can't seem to send the right signals to make it happen in the right order. Fourth is agnosia. This is all about recognition. They might look at a familiar object, like a hairbrush, and have no idea what it is or what it's for. Or, and this is the really tough one, they might not recognize a family member. Their eyes and ears work fine, but the brain can't make sense of the information. And finally, our 5th A is abulia. This is a deep lack of motivation. It's not about being lazy, it's a symptom of the disease. It leads to this profound apathy, where the person just loses that spark, that spontaneous drive to do things. Okay, let's switch gears and talk about some of the newer treatments out there. These are the kinds of things that are definitely starting to show up more on exams. It's only about 4 questions, but they're important ones to know. You absolutely have to know the difference between ECT and TMS. Here's the best way to think about it. ECT is like a full system reboot for the brain, a hard reset. It's powerful, it requires general anesthesia, which means the patient has to be NPO, and it works by inducing a seizure. TMS, on the other hand, is much more targeted. It's like software optimization. It uses magnets to gently stimulate a very specific part of the brain, and the patient is totally awake and alert the whole time. Pharmacogenetics sounds really complicated, right? But the actual process is super simple. All we do is take a quick cheek swab, send it to the lab to analyze the patient's DNA for certain liver enzymes, and then we use that info to predict how they're going to respond to different medications. It really helps us skip a lot of that trial and error and get our patients on the right drug at the right dose much faster. All right, I know that was a lot of information. So now let's do a quick-fire rapid review just to make sure those most important facts are really stuck in your brain. Ready? First question, in a patient who is at risk for refeeding syndrome, what is the #1 key lab value that we're worried about dropping?
You got it, low phosphorus or hypophosphatemia. Now remember, we're watching all 3. Potassium and magnesium are super important too, but that low phosphorus is really the hallmark sign.
Okay, next one. You're getting 2 different patients ready for procedures, ECT and TMS. Which one of those patients needs to be NPO, meaning nothing to eat or drink? It's ECT. And why? Because of the general anesthesia. That's a huge safety point. Anytime a patient is going under general anesthesia for any procedure, they have to be NPO to prevent aspiration. Okay, we've covered a ton of clinical knowledge for your exam, but let's finish with something just as important, our role as professionals. As psych nurses, we have a huge opportunity to fight stigma, and this is how we do it. First, we have to check in with ourselves and reflect on our own attitudes. Then we use our voice to speak up and correct myths. We can get involved with great groups like NAMI. And maybe most importantly, we just role model compassion and share what we know in every single interaction. So as you wrap up your studying, I want you to remember why you even started this whole journey. All this knowledge is so important, but it's really just a tool that helps us connect with the human being sitting right in front of us. So my last question for you is, how are you going to use everything you've learned today to always see the person, not just the diagnosis? You're going to be an amazing nurse. Go ace that final.